Hello, I'm your State Representative Mary Dye from the 9th Legislative District. Thank you for joining me today on this legislative update. The 105-day session began Monday, January 9th in Olympia. For the first time in 2 years, we're meeting in person at the state capitol. There are many issues for us to address in the 2023 session, but today I'd like to talk with you about legislation I have proposed to create a new Washington State Commission on Boys and Men. There are many issues that impact boys and men. They have the highest homelessness rates. In our state, 77% of suicides are male. Boys are far more likely to be suspended in Washington schools. 3 out of 4 suspensions in our state's classrooms involve boys. Enrollment rates of men in higher education are alarmingly low this year. Data shows that Washington's male population experienced disparities in the area of well-being, in particular in educational achievements, in drug and alcohol addiction and overdose, and other serious issues. We want to get to the bottom of this and find out why these rates are so high, and then work to create policy that lifts our male population towards better and successful lives. Under House Bill 1270, the Commission will focus on key areas involving boys and men: education, jobs, career and financial health, fatherhood, family relationships, and physical and mental health, and the experiences of males in the criminal justice system and other court systems. Today I'm honored to introduce an expert in this field. Richard Reeves is an author and a senior fellow from the Brookings Institute in Washington, D.C. Thank you for joining us.
Thank you for having me.
It's my pleasure. Tell us about some of your concerns regarding today's male population and what can we do to address some of these issues?
Well, when you look at what's happening in employment, in education, in mental health care, and in family life, what you see is that there are a lot of boys and men who are just really struggling, having real problems. So we know that there's a huge gender gap in education, for example, with like hugely bigger numbers of women going to college now than men. We know that many fathers are struggling to remain in contact with their kids. We know that male suicides are 4 times higher than for women. We know that 2/3 of drug overdoses are men. And so there's really a growing recognition that there are a series of social, economic, and family problems facing boys and men that we just need to address seriously through education policy, through employment policy, through healthcare policy, and just have a really specific lens of like what's happening to our boys and men in the same way we do for girls and women. And we have lots of institutions and individuals whose job it is to look at those particular issues through the lens of what does this mean for our girls and our women. We need to do the same thing and say, what does this mean for our boys and our men?
Washington's Commission on Boys and Men will be one of the first of its kind in the nation. Do you think this groundbreaking legislation will make a difference?
It would be the first state-level Boys and Men Commission in the US. There have been previous attempts that really haven't taken off, but I think the mood is different now. I sense a growing recognition from legislators like yourself here, but also just around the country, and in fact around the world. So Norway just created a commission on boys and men, for example. And the more I talk to people, this penny's dropping that we've got to take this seriously. We've got to just look squarely in the face at the fact that boys and men need this kind of help. And a state level commission is ideally placed in many ways because so many of the policy levers that you're talking around education, healthcare, and so on, are actually determined at a state level. And so I think that a state which actually steps forward and says, we need an institution that actually just has it as its job to be raising these issues, is likely to become a leader. Certainly that's my hope, is that were you to be successful in creating an institution along the lines of the commission you described here, I know for a fact other states are watching, and I know that there are many people who think that that could be something that would be complementary. I think it's important to mention that most states already have a women's commission or a women and girls commission, and they do very good work around similar issues for girls and women. And so I see these sorts of initiatives as complementary to the ones that we're used to talking about for women and girls. And I don't see any contradiction between the two. After all, we can both think 2 thoughts at once. And if we happen to have a son and a daughter, we probably want them both to flourish. And so the idea that you should only care about your daughter or your son is crazy for a parent. But it should be equally crazy for policymakers to be asked to either care about women and girls or boys and men, or only to have an institution for one and not for the other. We're perfectly capable of thinking 2 thoughts at once.
thank you so
You're
much
welcome.
for your thoughts. And House Bill 1270 has been referred to the House State Government and Tribal Affairs Committee, and I'm working to get the public hearing on the bill. And please watch my website for more information on this and other legislation I'm working on. Also, be sure to contact my office with any questions or comments or suggestions about legislation. It's an honor to serve you. I'm your State Representative, Mary Dye.